Hello everyone, welcome back to GDC classes. So today we are going to discuss about the dose adjustment in renal failure. So we are at the 22nd video of our biopharmaceutics challenge. So let's start with what exactly do we have to consider while talking about the dose adjustment in case of renal failure patients. So whenever the dose adjustment is considered, number one thing in any case of renal failure patient we have to see is the GFR, that is the glomerular filtration rate. So based on the glomerular filtration rate, number one thing which is the GFR. So you can see here we have the values of renal clearance. Based on the value of renal clearance, we have 0 less than 130, 130 greater than 130, 650. Now based on these we have the different mechanisms of the renal clearance. For example, if the value is 0, that is the drug will be filtered and reabsorbed completely. This can happen in the case of glucose. If the value is less than 130, then the drug is filtered and reabsorbed partially, which happens with the lipophilic drugs. Now if the value of clearance is near about GFR 130, then drug is filtered only, and the major examples today that I needed to show you, that is creatinine and inulin. So for the measurement of GFR, which is the glomerular filtration rate, we use two compounds mainly. For the number one has an exogenous origin, number two has an endogenous one. So for the endogenous we have creatinine, that is why mostly we look for the values of creatinine. Second we have exogenous, that is our inulin. Okay, then if the value is more than 130, then drug is filtered as well as actively secreted, and with the highest value we can say clearance will be equal to renal plasma flow. So what's the point here? Number one, if in any case dose adjustment is required and the patient with the renal failure comes up, so in any case we have first to check the value of the GFR of the patient. Second parameter is, number one is clear, I think you can see already. So number one, check the value of GFR. Number second is to calculate the renal function. Number one is to calculate the GFR. Number second is to find out the renal function value. So renal function value is equal to creatinine clearance of patient upon renal clearance of normal person. Right? With that comparison being made, we can find out the value of the renal impairment conditions. So if this value of the renal function is more than 7, if the value of renal function is more than 0.7, then no dose adjustment is required. Then no dose adjustment is required. Kindly focus. But if the value is less than 0.7, if the value is less than 0.7, then we can say the dose adjustment is required. Now dose adjustment can be made by using two approaches. Number one, either we can change the dose keeping the interval constant. Number second, we can increase the interval. Number second, we can increase the interval keeping the dose constant, right? Number one, it was reducing the dose and keeping the interval constant. Number second is increasing the interval keeping the dose constant. So here you can see in the dose adjustment in renal failure, if the renal your function is greater than equal to 0.7, which is considered normal, but if it is less than that, we have to consider the dose. So the for the calculation of the dose, while you have to decrease the dose, it will be equal to normal dose into renal function value, right? It will be normal dose is equal to renal function values, because we have just mentioned that we have to either focus on reducing the dose. Now if the dose is required, then how you calculate? You just put the value of normal dose into renal function. If dosing interval is computed, you can calculate it by normal interval in hours upon renal function. So these two approaches are generally used. Now first was GFR, second was calculation of the renal function, where you have seen how the dose is calculated, or we can see the interval is kept constant or it can be changed. Third is the actual values where we have to calculate the values of the clearances, right? Creatinine clearance. So for the children, we have the formula, very important. Please focus on this between 1 to 20 years. Now this topic is very important for all the pharmacist related exams, mainly GPAT, NIPER, DI, RRB, DA anything you are preparing for, these formulas are very important. Kindly have a look. So for the children between 1 to 20 years of age, we have creatinine clearance as 0.48 into height upon serum creatinine value into weight upon 70 whole raised to the power zero point 0.7. For the adults, mainly males, that is above 20 years of age, it is 140 minus age into weight upon 72 into your serum creatinine value. Similarly, for the females, we have just to put here, instead of 72, we have to put 85. So the value comes out to be 0.9 of the clearance of the male. So just like that, questions can be asked. So it is clear to you now that dose adjustment is required, but we have to focus on the GFR, then renal function, then we have to change the dose. Okay, the dose can be changed or the interval can be changed. Either way, it can be kept constant as well. And the major formulas for calculating the clearance are here for children, for male and for female. Thank you so much. We'll meet in the next video.